In summary, is there anything about an autopsy or the procedure or my career that I really, really don't like? I'm Dr. Wolfe. I'm a forensic pathologist. Medical examiner is the term used in some states. Yes, actually, there are a couple of things that I complain about. I do love my job, but there are some technical difficulties with cases, and I actually spoke about one yesterday, and that is cases where the patient has a lot of internal scar tissue. So this happens usually when there is multiple surgeries, and what happens is when you open the body up and you do surgery, the body will react to that. They will react to that by creating adhesions, little tiny bits of fibrosis between the organs. And somebody yesterday asked me, why is it so bad? Why does that matter to you at all? You have a scalpel. Well, here's what it's like. So imagine all of the intestines, all 20 some feet of the small and large intestine, the associated visceral fat, the organs like the kidneys and the pancreas, spleen, liver, gallbladder, stomach, and all of it has been glued together with super glue. And I have to get the organs out without destroying them because I need to examine them pathologically. So it is very difficult to basically separate all of those adhesions. Your blades go dull when you're doing it. You have to switch blades many times. It's incredibly tight. They will adhere to the abdominal wall or adhere to other organs. And I'm exhausted after I do those cases. Those are the only cases where I become frustrated. So even after doing this for many years, I sort of internally, I'm getting very angry when I'm doing these cases. Now, the patient, of course, can't help it. It's just, that's the way it is. But I would say that's the worst part of the procedure for me. Fortunately, that's a minority of cases. Now, in terms of a lot of people will piggyback on this and say, does anything gross you out? And the answer to that is no, not really. Decomposition doesn't bother me at all. Just various changes, pathology changes and necrosis and things like that. Nothing grosses me out. However, if I had to pick one area that I don't like dealing with, it's stomach contents, in particular when someone has had a very large meal before passing away. Now, there's one other aspect of this career that I don't like, and it does deal with court. And some people will think, oh, well, he doesn't like to testify. Testifying is scary or whatever. No, I love testifying, and anybody watching this who's seen me testify knows that I know how to testify, and I enjoy it. I enjoy it because it's strategic. There are, like defense or prosecution, depending on which side I'm on. They try to trip you up a little bit with the questioning sometimes, and it's like a little chess game. It's like a mental chess game. It's certainly sharpened my mind without question. I mean, you have to prepare for it, but it is my mind is functioning at an all-time level because of all the testifying I've had to do. But what I don't like about it is that very rarely does court run on time. So I have to prepare for hours for a case, or I do. Some pathologists don't, but I do because I like to win. And so I will be there when the testimony is supposed to start, and then it gets delayed, and then there's a witness that falls over on the witness stand, or somebody threatens somebody, and then everything gets drawn out. And sometimes I'll show up at 8:30 for a case, and I won't be testifying until 3:30. And there are some times where the case is canceled or there's a mistrial or moved, and I've driven 3 hours, waited 6 hours, and then had to drive back home. So I love court. In fact, I would like to be a lawyer if I could, in addition to my forensics. But that's what gets me the angriest, because I hate having my time wasted. It's just a personality defect of mine. Is if you waste my time, I get very, very angry. And so, that's it probably, I would say. But overall, I mean, it's a great career if you're set up mentally and physically to do this career. But I would say that's it.